Welcome to Sensible Health Solutions, the show where we simplify health and wellness. Join your hosts, Hallie Fields and Dr. Scott Luper, as they share practical tips and expert insight to help you navigate common ailments, nutrition, and overall well-being. Tune in for straightforward advice that empowers you to live a healthier life.
Hello, Dr. Luper. How are you?
Hello, Haley. I'm doing great.
Good. Well, this month, I think we are primarily focusing on different biomarkers in labs that you often test for. And today, you thought of going over blood oxygen.
Yes, blood oxygen is a important measure to tell how healthy our patients are, how much problems they're having. And we do a pulse ox. You guys do it, I know. So you give me the numbers. But you do a pulse ox on patients. We put the little clippy thing on their finger and then wait for a count of 4 or 5. And then, boop, the number pops up.
And it gives you the oxygen
the
saturation.
Oxygen, yeah. And also gives us a pulse. And that's useful information to tell how healthy people are. We get the blood pressure, sitting and standing. We get temperature, we get weight, and that's our normal intake to get a sense of how our patients are doing.
So how does that give you an idea of how healthy they are?
Well, if their blood oxygen levels are running high, 99 and 100, we know at least they're well oxygenated.
Yes.
If they're running low, let's say anything 96 and below, then we know, well, they're not well oxygenated. And this may explain why they're tired, why they have headaches, why they have heart disease, maybe explained by their heart disease or by their lung disease or by their metabolic disease. Sometimes people just have a problem in their cells. Their mitochondria don't work right. And so oxygen turns out to be super important to get a sense of how well people are doing. For example, with COVID, it affected people's lungs frequently. And it was pretty near the beginning of the whole process where the doctors realized that basically no one died who had a blood oxygen level higher than 90.
Okay.
They get sick, but
Higher
they
than
wouldn't actually
90.
die. Yeah, 90%.
Okay.
So if you were above 90, you were just really not in a position to be dangerous to die. Now,
Sure.
here in Fairbanks, what that resulted in is if you were above 90, they'd send you home. You'd go to the hospital. I have COVID. I'm sick. I need to be in the hospital. And they check your blood oxygen levels and say, no, you're not sick enough. You need to be going home. I had patients that had that happen, and they were like upset. I'm afraid I'm going to die. Nope, you're good.
Yeah, okay. So why is that?
Because your body, if it gets enough oxygen, then, and with COVID, it would just be, to keep it simple, it would just, you would just survive. Now, the key thing here is the number 90. What's special about 90? Why 90? The answer is 90 meets our basic body's needs.
Yeah.
Below 90, we don't. We fall short. Parts of our body begin to break down because we're not getting enough oxygen.
Well, I'm thinking for all of the vitals I've ever taken in this clinic, I've never seen a 90 read. That seems very low.
It is. You're extremely low. You're exactly right. We have had one. We have a patient, I'm thinking of him. He's got lung disease. He came in with an 87. So you didn't take it, but someone else did.
Okay.
We've seen it be lower before.
Okay.
Now, here's the thing about 90 is 90, you want to consider 90 to be the bottom and 100 to be the top. It's not like I come in at a 91, oh look, I get an A. I got 91%. You know, it's kind of A minus, but still I'm there. No, wrong. 90 is the bottom, that's a 0%. 100 is the top. So you come in at a 99, that's 90%. There's an A. 98, well, that's 80%. That's a B.
Yeah.
Right?
Yeah.
97, now we're into C territory. 96, that's a D. 95, you failed.
You failed. Anything lower is
That's
failing.
how to think about it.
Yeah.
And anything lower, that's just shades of F.
Okay.
Now, what does that really mean? It means if you're running a 95, you didn't take the stairs. You couldn't make it upstairs. You'd have a hard time, you run out of breath.
Walk into
now,
your
if you
car
have a
in the
90,
morning.
You can't get to the car.
Okay.
You're staying home.
Yeah.
Or have them come pick you up and take you to the hospital. Seriously, people 90, they can't function. because there's just not enough oxygen. So we do occasionally have people come in at 95s and 94s, and they're usually really sick.
Really slow.
Really slow.
Yeah.
Yes, you're right. Exactly. So you know in the real world, the practical world, to be able to see people, to know what that translates to. Mm-hmm. So this turns out to be a really good measure of how well things are working on a basic level. Okay, very good. Now it's more complicated than that, because that number does not accurately represent how much oxygen you're really moving, because some percentage of your hemoglobin, that's the little molecule, it's kind of shaped like a box, that's the little box that carries oxygen from the air to your cells. Now let me back up a bit and say, imagine, if you will, we got a lung over here and we have a knee cell over here, right? And the oxygen from the lung somehow has to get through the bloodstream over to the knee cell. Now it can't just dissolve in the blood, because not enough will dissolve. It won't work. It doesn't work. So what the body's come up with is this device of putting a little piece of iron, an atom of iron, in the middle of this little box, because iron has an affinity for oxygen. Mm-hmm. That is, if you bring iron near where oxygen is, oxygen will jump on of its own accord. It wants to be there. It just jumps right on. Now, you've seen this before in your yard when you dig up a rusty nail.
Yeah.
And the oxygen all jumped on.
Yeah.
And it rusted. Mm-hmm. That's what this is. This is oxidized iron, otherwise known as rust.
Okay.
So you go over, oxygen jumps on your little teeny piece of iron, right? And it rusts it. And then it goes over to your knee cell, and that oxygen jumps off, right? And then it goes around to the lungs, and another one jumps on. And then it goes around to another cell in your body, and it jumps off. And this transporting oxygen back and forth. Yeah, except for jump off. Why did it jump off? That doesn't make sense. I never seen anything unrust. They rust. They don't unrust. What's the deal? Why does the oxygen jump off? The answer is the box itself is set up to be able to pop that oxygen off. There's a little place at the bottom where two carbon dioxide molecules sit and force the oxygen off. Just literally pop the oxygen off.
Okay.
It's known as the Bohr effect. There's a name for this, right? Mm-hmm. And so this whole system of oxygen transport depends on, oddly enough, carbon dioxide.
Okay.
Now you would think carbon dioxide, no. Oxygen is in with the good air.
Yeah.
Carbon dioxide is out with the bad air.
Right, and you don't want too much carbon dioxide,
Yeah.
or else you suffocate yourself.
Because you suffocate, because you have too much carbon dioxide. So it is a interesting fact that carbon dioxide is absolutely necessary for this whole system to work. Without carbon dioxide, it does not work. The oxygen does not jump off the iron atom.
Mm-hmm.
It sticks.
Well, as you're explaining and using your hands through this, I'm just wondering, also, could it be a red blood cell problem that they don't have enough oxygen in their body? They don't also have enough red blood cells?
Yes,
Okay.
absolutely. And what the reason why the red blood cell is the issue is because red blood cells carry hemoglobin.
Mm-hmm.
And so it's really the hemoglobin.
Yes.
And what it's really saying is really the oxygen carrying capacity of the blood. So how much hemoglobin you have is how much oxygen you can transport at any one go. Now if your hemoglobin is low, you still can transport oxygen, you just can't do much at any one go. So what tends to happen is, first of all, people are tired, there's that. Secondly, they tend to have a rapid pulse.
Okay.
Because since the blood can't carry that oxygen by itself, well, the heart can just beat faster. Boom, 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 boom. Now more blood is flowing,
right.
and so the carbon, the oxygen coming through the hemoglobin, there's just more flow, and then it compensates for it. Of course, it doesn't compensate that good
Can't.
when you got to run.
Yeah.
Because you're already running.
Uh-huh.
You're living at a run.
Yeah,
the
so
whole
do they
time.
often feel like they are constantly, like, living at that elevated state?
Yeah, they feel tired. They
Okay.
can't get around. So you're right. There's more to this than just you need carbon dioxide. You also need hemoglobin.
Right.
You also need oxygen.
Yeah.
I mean, you go to the top of Mount Everest. There's not much oxygen up there, and so it's hard to get the system to work very well. So yeah, the oxygen is necessary, the hemoglobin is necessary, the carbon dioxide is necessary, the blood itself and the the red blood cells are carrying the whole thing moving through is necessary as well.
Okay.
I mean, the whole thing is necessary. So if there's a problem with people's getting oxygen into their body, then there's any number of things to look at here. And the thing is, doctors are used to looking at someone, do they have enough blood? If they had bled out and they're in shock, they need a blood transfusion. So there's one thing. Or if they come in and they're pale and they're tired and they have a rapid pulse, there's a real good chance they have anemia.
Mm-hmm.
And so that's a thing.
Mm-hmm.
But very rarely does any doctor think, oh, my patient's short of carbon dioxide.
Huh. Why?
Because it's just not commonly thought of. Now, admittedly, there are doctors who do think this.
Okay.
Because they see people coming in with low carbon dioxide frequently, weekly at the least, probably daily.
So is there a way to just measure carbon dioxide in the system?
Yes, there is.
Okay.
There is. Though it's tricky. Now, hold on. Let me finish my thought first, then I'll come back to measurement. My thought is there are people that get air hunger, and they breathe deeply to try to get more air, because that's a normal thing to do when you have air hunger. And they do this thing where they lean forward and they get this intense look. See that? That's an intense, I'm dying.
Mm-hmm.
I need air.
Mm-hmm.
And notice how fast I'm breathing when I do that? Mm-hmm. Now, I'm getting more oxygen in my body, and I'm thinking about it. I'm getting more oxygen in. I'm also blowing my carbon dioxide off. Let me show you again.
You're letting it go just
Yeah.
as fast as it comes
The
in?
more I breathe, the more
Mm-hmm.
my carbon dioxide just naturally blows out.
So you're saying in order to treat the low oxygen, to hold the breath for a moment.
Well, yeah. The thing is, people don't know that.
Sure.
They're home.
Mhm.
They're freaking out.
Mhm.
They're having a panic attack. They're
They
got
can't hold their breath.
air hunger because they need air.
Sure.
They need air. And so they're going to breathe because that's what you do.
Mhm.
And then you think, I'm dying. I'm lightheaded. I'm freaking out. You got to take me to the hospital. I have to go to the hospital right now. And so into the car or the ambulance, whoop, off to the hospital they go. Into the emergency room. Right? And they're doing this thing, this breathing. They show up. The doctor looks them up and down. And then do they put oxygen on these people? No. They hand them a paper bag.
Mm-hmm.
They breathe like this. I can breathe. That's amazing. How'd you cure me with a paper bag?
Yeah. Okay, so what...
Why does a paper bag work?
Because it forces your system to metabolize the carbon dioxide.
Well, it not metabolize. What it does is just simply collects it.
Yeah.
And so instead of breathing it out, you breathe it in.
Yeah.
And your carbon dioxide levels go up, 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 up. Now, why does carbon dioxide help us breathe better? Honey? Funny? How does that work?
Because it pushes the oxygen to where it needs to go.
It allows the little box
To
let
jump
the
up.
oxygen off.
Yep.
Without that carbon dioxide, the box just holds on. Let me show you. Here's your lungs. Oxygen jumps on,
Mm-hmm.
and then it goes over to the cell and does nothing. Then it goes back to the lung for more oxygen, except for it's already there. This didn't come off.
Mm-hmm. So go back.
It's still attached.
Go back to
it
the
didn't
cell.
work.
Okay.
So you lose a percentage of your transfer.
Okay.
If it's a teeny percent, man, who cares? We got a lot of extra capacity. If it's a large percentage, I'm dying. I'm dying of lack of oxygen, and you check my oxygen saturation, and it's high.
So what is the long-term treatment for increasing the oxygen transfer?
So, yeah, there's not one treatment. Depends on what's broken. Now, let's just go with some of the things we already know about.
Yep.
Let's say there's not enough hemoglobin. The treatment is we need more hemoglobin. Either we do a transfusion,
Mm-hmm.
It's problematic, diseases and such, or we work on making more hemoglobin.
How
That's
do you
what
make
I
more
choose.
hemoglobin?
That's a good question. So, what everybody wants to do is they want to take iron.
That's
and
what I've heard.
That's not always the problem. Now, if you're short of iron, that is the problem. It takes care of it. But hemoglobin has only got one little atom of iron, and then it's got all this other protein around it. So what you need to do is you need to get protein in your body,
Okay.
you need to have a body that works. That is, your digestive system works, your kidney works, your lungs work, your liver works, all these things. That's how you do it. You got to fix all that stuff. So what we end up doing with people who have like weird anemia that there's no good reason, their iron's not the problem, their iron levels are fine, we give them Chinese herbs. I'm sorry, I don't know why these work. The Chinese herbs are just a trip. They work fabulously. We use a product called Marrow Plus, and it really is wonderful. And this just came word of mouth. I never figured it out. I never read any research. We just talk back and forth, doctors, and they say, oh, have you ever tried this stuff? I started using it. It's great. That's how it got to me.
Wonderful.
Health concerns makes it.
Okay.
And it just works fabulously what it does. And people's blood just builds. It's like anemia for no reason. People have a low iron anemia, then what we need to do is give them iron. Now the problem with iron, if you give people iron straight, it doesn't work that well. Mostly it's given in the form of iron sulfate, which is kind of classic for iron, and it makes people constipated, and it doesn't really work all that great. I mean, it'll build blood, but then you suffer for the constipation. So what we use is an iron in another form, some other chelated iron. Iron picolinate, for example, is a nice one. Some other kind of iron that's absorbed well and doesn't cause constipation. So we use a product called Fairsorb. But honestly, the best way I like to get iron is from food. And the best way to get it is from things that have blood in them, because we want to use...
Or using a cast iron skillet.
Yeah, the other thing, you can use a cast iron skillet. That's another way to do it. The only trick with the cast iron skillet is you have to use a metal spatula, because it's the scraping that pulls up the little, knocks the atoms up and put it in the food. You got a nylon spatula, you're not getting hardly any iron whatsoever. You got to scrape on it.
Okay.
Okay, so back to the fixing people with low oxygen carrying capacity. There's another thing you can do in order to absorb iron. Sometimes the problem is not iron availability. You can take it in a pill, you just don't absorb it. It's the fact that people's stomach acid's low.
Oh.
And if you have low stomach acid, then the ability to absorb iron is poor, because iron has to go through an acid bath and have one electron stripped off and makes it sticky. And then as it goes through the digestive system, that stickiness allows it to attach to things. And then you suck it in. Without that acid bath, it's not sticky. It's good. It's just neutral. And goes right on through you.
So
most iron is not absorbed anyways.
So in order to increase stomach acid, do you have them drink like apple cider vinegar?
That's one way to do it.
Okay.
It's a little on the weak side. Millions of people are drinking apple cider vinegar and it's working fine. So I don't want to argue what the best way to do it.
Or like fermented food, like kombucha, or kimchi or
acid
sauerkraut.
generally is the way to do
it.
If you want to do the best treatment, what you do is you take hydrochloric acid, and it comes in a pill form, and it's not acid like, shake around, it's liquid. It's dry powder. It's known as betaine hydrochloride, and it works great. Works beautifully. And I have patients who have a problem with this, and I just put them on betaine hydrochloride, and it solves the problem, and their anemia gets better.
Is betaine hydrochloride also baking soda?
No. Oh. Baking soda is different. That's sodium bicarbonate.
Oh, okay. I'm getting confused. And that's to suppress the acid.
You asked about carbon dioxide. How do we check it in the blood? If you just ran a carbon dioxide test for blood, because that's part of a normal panel, it shows carbon dioxide, and you think, wow, that's my carbon dioxide. No, it's not. That number is 90% bicarb. Because most of the carbon dioxide in our blood is in the form of bicarb. Bicarb is a buffer. It's an acid-alkaline buffer. So if your body's acid, then the bicarb absorbs it, and so you're not acid anymore. Or if it's alkaline, your body absorbs it, and then you're not alkaline anymore. And so it works as a buffer. Now, if you absorb a lot of acid, the buffer goes down. So when I look at people with carbon dioxide level, and the numbers range from like 21 to 30 or 22 to 32, somewhere around there. And they should be running around 25, 26. And if they're running low, 21 or 20 or 19 or like that, it's not that their carbon dioxide levels are low. That's not the problem. What it is their bicarb is low. And so what they need to do is they need to take baking soda.
Okay.
And they do better. They feel better with baking soda. It gets it alkalinizes their blood, and they feel better. And also you want to figure out why their blood get alkalinized to begin with. Sometimes it's diseases, sometimes it's diet. Let's go back to the oxygen thing, though. because, there's a lot of people who are athletes, and they're going to be listening to this thing, and they're going to be thinking, so he said carbon dioxide helps with oxygenation, so if I had more carbon dioxide, I would have a better percentage of oxygen release from my blood. I could run faster.
Or harder, or
I could
lift
do more.
Right.
I mean, I could actually be a better athlete if I had more carbon dioxide.
I could be a superhero.
I could be a superhero, right.
Mm-hmm.
Well, we wouldn't be the first ones to think this.
Okay.
And
is it true?
It turns out it's true.
Oh, wow.
And so now the question is, okay, so if we get more carbon dioxide, how do we do that? Do we have to, we're going to race on a bike, we have to put a tank on our
Are
back
we going to have to breathe through a bag while we bike or run or sprint?
Our body already comes with this system already in place. If you could simply breathe through a straw,
okay,
in and out, it creates pressure. And that'll cause the carbon dioxide levels to rise in your body. Mm-hmm. So you just need to
breathe through
a straw.
Or pursed lips.
Pursed lips, yeah, except for the thing is, we come automatically equipped with 2 straws, one here and one there.
Okay, so just breathing through your nose?
There it is, bingo.
Oh,
That's
perfect.
how you do it.
So
the
constricting the amount.
The bike racers, because it constricts the air and it pushes, gets the back pressure for the carbon dioxide levels to go up. The bike racers have been taught to, like Tour de France guys, they've been taught to race breathing through their noses because it creates a little back pressure, and then they get better
performance,
better carbon dioxide back pressure. Carbon dioxide levels go up. They get better oxygen release, and they've actually measured it because those bike racers are all wired up to measure wattage, right?
Yeah.
And what they find is they get 6% more efficient when they breathe through their noses than when they breathe through their mouths. Now, you don't sound like much, but if you're racing against these guys,
6% is enough to win a race. That's enough.
You bet.
That's the
but
difference.
now everybody
between...
knows the trick, so
Sure.
they're all
training that way.
Yep.
Okay.
So other athletes too, runners. The problem is you can't necessarily get a full maximum oxygen intake through your nose. Now, the bike racers, they spend 5 hours kind of tooling along. Admittedly, they're riding fast, but they're real efficient. They're in a pack. They're not using that much energy. They're breathing, but you can breathe through your noses. As soon as they get to the top of the hill or a sprint or the end of the race, now they're definitely breathing through their mouths because you can't get enough air in. Mm-hmm. Now they're huffing and puffing to the maximum. They go into aerobic maximum is what they do. That's another deal. And with aerobic maximum, you're generating so much carbon dioxide because your metabolism is so intense from your muscle contraction that you're flooding your system with carbon dioxide, so you're fine. Really, the numbers go up fine. So it's not sprinters really need to do this. It's the long distance aerobic sports that need to do this. And you all need to breathe through their nose. Now,
I'm thinking about swimmers and how they might breathe through their nose.
Well, they're holding their breath a lot. I think they're good.
Okay.
They're pretty much full on max carbon dioxide already. Yeah, it's the cross-country skiers, because we have a lot of those around here. Zillions of people train to ski and like to compete. You have lovely races, young people and old people and all kinds of people mixed together doing this race thing.
Yeah, it's a great time. It's a great community.
And they are trained to breathe through their nose because it conditions the air better. You're not taking the cold air and putting it down in your lungs where it can cause lung damage. You're actually going through the process of conditioning the air, cleaning the air, moistening the air, warming the air, and you get a much better action by going through your nose. Now, the tricky thing is you have to have the strength of will to breathe through your nose and let that be the limiting factor. And what I've discovered is if I breathe through my nose, I have to breathe long and deep. I have to... Not... That doesn't work. Long and slow. So it changes your breathing pattern. And it takes some practice, but you can get it down and you can actually go faster and breathe better, go through your nose. So there it is. Now there's one more thing I want to talk about. And we may have more time, I'm not sure, but there's one more thing I want to talk about, which is how to get our carbon dioxide levels to go up without racing in the Tour de France.
Sure.
And breathing through our
Yeah,
nose.
just for us normal patients
Yeah.
who don't have these huge competitive aspirations.
So I got a few patients here who have COPD. That's chronic obstructive pulmonary disease. It's lung disease. And there's lung damage that's associated with this. And what it results in mostly is that people's lungs don't have much elasticity. The way we breathe is we open it up, that's stretching the rubber band, and then we just let the rubber band fall back to have our air go out. So our effort goes in the inhale, and then the exhale goes on its own. With COPD, we do the inhale, but the rubber band's broken, and it comes down a little bit. Inhale, rubber band comes down a little bit. Inhale, rubber band comes down a little bit. And they just don't get enough air, and they're just running short. They're running low oxygen all the time.
Yeah.
Anyway, so what's helpful for them is to get the full maximum carbon dioxide transfer so that they don't have a significant percentage of their blood having the oxygen go around back and forth and never leave the hemoglobin. That's a dead hemoglobin. Okay, we don't want that. So how do we get rid of that? If we can get the carbon dioxide levels to go up, then we can knock those off and get them back online again. And the way to do that is to hold your breath. Now the problem is with people with COPD can't hold their breath for 5 seconds because they're short of oxygen.
Right.
So you got to do some sort of setup for them to be able to get their body fully oxygenated, and then they can hold their breath. So the setup is you do 30 deep breaths. You breathe into your belly, and your chest, and your head, which is funny because there's no lung in your head. Doesn't matter. Imagine
all the way
it.
up.
That's right. And then let it fall on its own cord. You don't push it out. So it's all the way down. You do that 30 times. What you'll do is you fill yourself full of oxygen and you blow your carbon dioxide levels off because you're breathing deeply. And the deeper you breathe and the more air you move, the more carbon dioxide level comes out. So your carbon dioxide levels are dropping. And what that does is it creates some space for on the 30th breath, you start the same way, and then let it come down, and then hold on the exhale, which
Hold
is crazy.
midway on the exhale?
Just let it come down all the way to the bottom. Just That's it. I'm not pushing it out. I just let it fall to the bottom and then hold at the bottom. And then you just hold it for as long as you can. And what that does is it takes your low carbon dioxide levels, because you just drove them down, and brings them all the way to the top.
Yeah, because you're restricting that air intake, that oxygen.
Yeah, because you're not breathing at all. And so normally you can't hold your breath. Let's say a normal person can't hold their breath for more than a minute, right? A minute's a long time. 30 seconds is a long time. Now, by doing this breathing setup, you can pretty much easily hold your breath for a minute, or 2 minutes, or 3 minutes even, like a normal person. Seriously. It's super. It's like it's a setup. So those professional breath holder people, they do this.
Yeah.
They blow the carbon dioxide out of their system so they can hold their breath longer, is what they do. Now, we don't want to do this in a pool. That's a bad idea.
Yeah, practice in your living room first.
Dry land.
Yes.
That's where we want it to be. And you do this, and what's going to happen is you're going to knock the carbon dioxide levels down, and then you're going to fill it up. That's like basically taking a stick and whacking the cells, the pieces, the hemoglobin, and knocking the oxygen off, and now they're going to work better. And suddenly, I feel better. Not only do you feel better, you have more energy, and I feel like, this is great. I actually feel better. This is a thing you can do at home. It's a simple thing. And you can do it in such a way that since you got more oxygen coming in, you heat up and you run warmer.
Oh.
It's like if you imagine that we're all wood stoves. We just turn the dampers open, and now oxygen's flowing in better.
And then the fire.
Burn a little hot.
Yeah. Wow, I
And you
didn't
feel
think about
better
it like
for
that.
So this is one of the mainstays that we do to treat COPD. Now you may wonder, if it's worked so well, why isn't everybody doing it? I don't know. They should. They should, honestly. I don't know why they do it, because not enough people know about it. Yeah, it should be done this way.
Well, hopefully somebody who
Listening.
struggles is
COPD.
listening.
Yeah, and do this thing. Again, the breathing description is super simple. You just saw it. Do 30 deep breaths, and then hold your breath on the exhale on the 30th one. Oh, by the way, if you really want to get the full maximum of this, as it goes with all this kind of stuff, you have to do it 3 times.
Okay. How long do you hold at the end?
As long as you can.
Okay.
Full maximum. Shoot for the record. Trippy, isn't it?
Yeah.
Makes you want to try it now,
I
doesn't
do.
it?
We're going to shut off. We're going to wrap up.
All right. Thanks, Haley. I appreciate
Absolutely.
the opportunity to do this. This is great.
We'll talk again next time.
Sounds good.
Thanks for tuning in to another episode of Sensible Health Solutions. We hope you found today's discussion enlightening and packed with practical tips to enhance your wellness journey. Remember, small changes can lead to big results. If you enjoyed the episode, don't forget to subscribe and leave us a review on your favorite podcast platform. Your feedback helps us bring you the best content possible. Stay connected with us on social media for more health insights and updates. You can find us at Sensible Health Solutions across all social platforms. Until next time, stay sensible and stay healthy. This content is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Seek medical advice from a healthcare professional for any medical conditions.